Hey guys, welcome back to Sean's fancy lab coat pathology presentations. Today's lesson is a twofer and will be on cholestasis and peptic and stress ulcers. So let's just jump into it. First, let's talk about cholestasis. Broken down, the word means still bile. Chola meaning bile and stasis meaning still. Cholestasis is a decrease in bile flow through the hepatic ducts and a reduction in the secretion of water, bilirubin, and bile acids by the hepatocytes. This causes the material normally transferred to the bile to accumulate in the blood. The pathology can be caused by liver diseases, which is referred to as intrahepatic cholestasis, or can be caused by an obstruction of the large bile ducts, which is known as extrahepatic cholestasis. Cholestasis can start in many different ways. Within the liver, it can be caused by acute hepatitis, alcoholic liver disease, cholangitis, which is inflammation of the bile ducts, cirrhosis of the liver due to viral hepatitis B or C, some medications like amoxicillin, which is related to penicillin, or oral contraceptives. Hormonal effects on bile flow during pregnancy can affect it, and cancer that has spread to the liver. Outside the liver, it can be caused by gallstones in the bile duct, a narrowing of the bile duct, cancer of the bile duct, cancer of the pancreas, and inflammation of the pancreas. Some characteristic manifestations of cholestasis are jaundice and pruritus, which results from the excess bilirubin deposited in the skin. Dark urine, which is a result of the excess bilirubin excreted by the kidneys, and light-colored feces. The light-colored feces are likely caused by the bilirubin being blocked from the intestine, preventing it from being eliminated in the stool. This also may cause the stool to contain too much fat because the blocked bile cannot help digest the fat in the foods. The patient may also have a deficiency in calcium, vitamin D, and vitamin K due to the lack of the bile in the intestines. A deficiency in vitamin K leads to excessive bleeding from not being able to form a blood clot, and a deficiency in vitamin D and calcium can lead to weakened bones, muscle spasms, and muscle cramps. Some other symptoms such as abdominal pain, loss of appetite, vomiting, or fever depend on the cause of cholestasis. The time frame for cholestasis depends on the cause. For example, if the patient is pregnant and suffering with cholestasis, the symptoms will disappear roughly 1 to 2 weeks after delivery. With acute hepatitis, the signs and symptoms of cholestasis will disappear when the hepatitis has run its course. Treatment of this pathology can vary. Pharmaceuticals may be prescribed to help with the pruritus, and if the bile duct has blockages, surgery or endoscopy are likely treatments. If the blockages are within the liver, the treatment will depend on the cause. If their physician believes the cause is from pharmaceuticals, they will stop the use of that drug. If the client has acute hepatitis, the cholestasis and jaundice usually disappear when hepatitis has run its course. The physician may also recommend not to take anything that is toxic to the liver, like alcohol or certain drugs. As a massage therapist, there is not much we can do to help with this pathology. If there is abdominal pain, massage to the abdominal area is locally contraindicated, and shorter treatments are generally suggested. Our main focus will be on a relaxation massage to try and relieve any stress the client has. Next, let's talk about peptic ulcers. A peptic ulcer is a lesion in the mucosa of the GI tract, usually occurring in the pyloric antrum or in the duodenum, and is caused by the digestive action of pepsin and the acids of the stomach. Stress ulcers and curling ulcers, which is a specific type of stress ulcer, develop in relation to a major physiological stressor. Curling ulcers are a complication that comes from a severe burn. The ulcer happens when reduced plasma volume leads to a thinning of the mucosal layer. A peptic ulcer can affect one or all of the layers of the stomach or the duodenum and may penetrate only the mucosal layer or penetrate deeper into the smooth muscle layers. Ulcers can go through spontaneous episodes of remission and exacerbation. If the smooth muscle layer is affected, it will heal, but it will be repaired with scar tissue. The mucosal layer can regenerate over the scarred muscle layer, but it will most likely be less than perfect and contributes to the repeated episodes of ulceration. There are a variety of risk factors that are thought to cause peptic ulcers. We will focus on the two most important. One being an infection with the bacteria Helicobacter pylori, or H. pylori for short, and the other caused by the use of aspirin and other NSAIDs. Both have been shown to impair the means by which the gastric mucosa is protected from the effects of the corrosive acid and pepsin of the GI tract. They are not fully sure how the H. pylori bacterium causes the development of peptic ulcers, but they believe the bacteria's ability to induce inflammation and stimulate the release of cytokines and other mediators of inflammation to be the cause. NSAID-induced ulcers are thought to involve injury of the mucosa and inhibition of the prostaglandin synthesis, which are involved with inflammation. Unlike other forms of peptic ulcers, ulcers caused by NSAIDs often don't show symptoms, and severe complications can occur without warning. Some signs and symptoms of peptic ulcers are dyspepsia, also known as indigestion, which includes belching, bloating, distension, and fatty food intolerance, heartburn, chest discomfort, gastrointestinal bleeding, and anemia, which makes you feel tired and weak, are also common. The time frame for peptic ulcers varies. If the ulcer is caused by H. pylori, the healing will start when the bacteria are no longer present in the body. If the ulcer is caused by medication, it should begin healing shortly after you stop taking the drug. Ulcers in the stomach may take up to 2 to 3 months to heal, while duodenal ulcers take roughly 6 weeks to heal. Treatment for ulcers caused by H. pylori usually involve a few different medications. A physician will most likely prescribe 2 antibiotics and an acid-suppressing medication. Treatment for NSAID-induced ulcers will involve no longer taking the NSAID and will also include antacids or other acid-suppressing medications. Like cholestasis, as a massage therapist, there is not much we can do to help with this pathology. Massage to the abdominal area is locally contraindicated and shorter treatments are generally suggested. Our main focus will be on a relaxation massage to try and relieve any stress the client has. Well, that concludes the presentation. See you guys next time, and back to you, Sean.